My name is David Pennington. I'm a pediatrician in Arkadelphia, Arkansas. So I'm a local pediatrician. We see kids all the way from birth up to 21 years old, and actually here at our clinic we'll see college-age kids also, as long as they're still in school, so that can be 23, 24 years old. We take care of everything from well child checks to sick visits to urgent cares, injuries. We kind of do it all. So I'm from a very small town called Holly Springs, Arkansas. It's about 30 minutes south of Arkadelphia. Went to a little bit bigger town, but still small, named Bearden for high school. And then I kind of migrated north to Arkadelphia, where I attended Ouachita Baptist University. Spent 4 years there, some of the best 4 years of my life, before I went to Little Rock for medical school. Completed my residency at Arkansas Children's Hospital, and then decided to come back down here to practice pediatrics full time. So from the time I was a kid, I always wanted to be an Army doctor, actually. My dad was in the military from the time I was born until actually just recently. And I used to dress up as an Army doctor every Halloween. And I thought that was the coolest thing. Actually didn't go into the military, but kind of stuck with being the doctor. I like pediatrics because I think kids are tougher than adults in a lot of ways. I like seeing the different stages they go through. We take care of them when they're just infants and they really can't do much. They're completely dependent on their parents till they start becoming teenagers. They start becoming a little more autonomous, start having thoughts for themselves, kind of developing into the people they're going to be in the future, and then all the way until a young adulthood. I kind of like the idea of thinking I'm going to see somebody today as an infant, and then maybe 30 years from now when I'm on the back end of my practice, I'll see that person when they're having kids and get to see their kids also. So first-time parents ask about all the weird things their kids do. Kids have kind of abnormal breathing patterns sometimes that are completely normal for them. They jitter, they chew on things. They do all these things that very normal kids do that if you've never had a kid before, you think, well, this is the weirdest thing in the world. So kind of get to walk through that with parents and kind of educate them on this is a normal kid thing. This is what they do. Kids sometimes poop 6 times a day, and sometimes they go 7 days without pooping. And all that is completely normal in infancy. So I always like to tell parents that kids are loving and they're great and they're just the most precious things on the earth. But they are also manipulative. And if you let kids trick you, they will. They know how to get what they want. So I tell parents, you need to be more stubborn than your child. And we all know that kids are pretty stubborn. But being more stubborn than your kid can kind of help them develop healthy habits, let them function better in life. We think about sleep time routines. You know, every kid out there seems to get real amped up right before bedtime, and you think, you've been awake all day, why are you so hyper right now? So talking to parents about good sleep routines, we do the exact same thing every night, and we put you in bed. If you let kids kind of trick you, say, well, I'm not tired, let me stay up later, they'll do it. And they'll do it as long as they can get away with it. So one thing that I've learned about being a pediatrician, it's dealing with kind of kids and their health care, but it's also kind of being a parental psychologist also, and kind of dealing with parents' anxieties and fears, and helping them understand what's normal and not normal. So if you're in the area ever and you have your kids around Arkadelphia, we're always open. Our providers are available 24 hours a day to actually speak to a doctor, so feel free to stop by and give us a call.